Hello guys, I hope all of you are doing well, and this is one of the questions of the recently conducted NEET PG 2023, right? Now, this is not a recall session. I've already done the recall session on YouTube. This is one question, only one question that I'm about to discuss for the future aspirants to make them realize that what is more important to solve difficult or confusing questions like this, where you can get confused in every other option. Now look at the question here. The question says, a patient presented with anxiety, restlessness, tremors, and fever. If you look at the symptoms here, anxiety, restlessness, tremor, fever, plus atrial fibrillation. Now this guides us towards a diagnosis of something like thyroid storm. Right, thyroid storm. The patient also has asthma. He also has asthma. So this asthma is important. This will help us to guide to the answer. What drug should be used next? Esmolol, PTU, propranolol, diltiazem. Now see, you have to understand in thyroid storm, what do we use? So first of all, obviously, the basics is I need to have a little bit idea about the endocrinology part. So in endocrinology, what do we study usually? In thyroid storm, the drug of choice is PTU, isn't it? But we also study the first drug that is used is not PTU, it is propranolol. Now, why is it that I'm using propranolol as the first drug in a patient with thyroid storm? And the reason lies in this, that is atrial fibrillation. So atrial fibrillation, what is important? We need to understand. See, whenever the patient has atrial fibrillation, now we have to go to the cardiovascular system. Whenever the patient has atrial fibrillation, my aim is to prevent this atrial fibrillation to come to the ventricle and cause ventricular fibrillation and causing cardiac arrest. That is how my patient can die. How would I prevent atrial fibrillation from getting converted into ventricular fibrillation? What do I have to block in the heart? I have to block the AV node. So I have to block AV node, and for that, what do I use here? I'm using propranolol. Now, if I look at this much, if I have this much of information, if I go only with propranolol as answer, why this becomes a wrong answer is pretty simple. Because the patient also has asthma, so it becomes wrong, right? But many students, they went with esmolol as an answer. Thinking what? Thinking that it's a cardioselective beta blocker and it is safe in asthma because it will not block beta 2 receptors. Now again, this is wrong. In autonomic nervous system, what have I told you time and again? That selectivity in pharma is never absolute. So if I say a drug is cardioselective, even then it means it blocks beta 1 more than beta 2. It does not mean it does not block beta 2. So even cardioselective beta blockers like esmolol can precipitate bronchospasm and worsen bronchial asthma. So esmolol is also the wrong answer. It is not the right answer here, right? So I've ruled out these two. Now what should be the answer? Now let us go to the cardiovascular system. I told you here that in case of atrial fibrillation, I need to block the AV node to prevent the atrial fibrillation to come to the ventricle, right, and cause ventricular fibrillation. So what are the AV nodal blocking agents that we know of? ABCD, right, adenosine, beta blocker, CCB, verapamil, and diltiazem, and the fourth one is digoxin. ABCD, and if remember, I told you something that the first two drugs, A and B, they produce bronchoconstriction, and both adenosine and beta blockers should not be given in asthma. Apart from that, adenosine, it can also cause atrial fibrillation, and because of that, it can never be used in atrial fibrillation also. So A and B are out. Now, the sequence of preference of these drugs is A, B, C, D. So if A and B are out, what comes next? To block AV node, what comes next is C. And do we have C in the option? Yes, diltiazem. So what becomes my answer is option D, that is diltiazem. In this case, to block AV node, I can use this drug, right? So you can see it's a multi-layered MCQ. And if you ask me, can I solve this just by having knowledge of PYQs, the older PYQs? No, you can't. You can see it's both a combination of endocrinology as well as cardiovascular system. Now, even if you have just the knowledge of cardiovascular system of atrial fibrillation, that I block AV node, and if I block AV node, there are four options, A, B, C, D. A and B are out because they cause bronchoconstriction. I go with C and diltiazem. That becomes my answer. Now, can I solve such kind of questions just by mugging up mnemonics or just by doing PYQs? No, guys. I have to take the longer path of concept. You have to understand the concept, and then only you'll be able to search options, and you'll not go for answers like SMOLOL. You'll go for answer like DLTSM, right? So, say in any exam, not only this NEET exam, so this what I'm telling, about to tell is not for who have given the exam. You guys have given the exam, forget about it. For the future aspirants who are about to appear for the next NEET PG or the next exam, don't take the shorter route of just doing PYQs, because that would be detrimental, because the questions which are being asked nowadays, 50 to 60% questions, they would be on the easier side, which most students would be able to solve. Now, those 50 to 60% which are related to PYQs, they will bring you into the race, but they will not help you win the race. So you are participating in the race to be in the race and to finish at a good rank. Now, so the remaining 40% questions, 30 to 40% questions, which are moderate and difficult ones, that is where lies how much good rank you are gonna get. And for that, you need to have a detailed understanding of the topic, right? And your basic concepts should be right about those topics. So just by mugging up PYQs, you'll not be able to cruise through and get a good rank. So you might find it easier not to go through concept. But remember, there is no shortcut to the Everest of success. You have to take the longer route if you want to be on that height of Everest. So guys, my best wishes with all of you. I'll keep on posting such MCQs time to time to guide you how to prepare and how the MCQs are being asked nowadays, which have become much more clinical, which have become much more multi-layered, and you have to apply your basic concepts.